From the markets to politics, Freedom Caucus member Ron DeSantis says that they are very close to a deal on health care. Roll tape.
The core thing that we have to do is deliver lower premiums and more choice on private insurance, because that is the reason why people dislike Obamacare, because their premiums have gone up and their deductibles have gone up. So that's really what we have to do, and I think if we can get there, I absolutely think we can pass something relatively soon.
Relatively soon. Have I heard that before? Come on in, Congressman Jim Renacci, Republican from Ohio. He happens to be on the House Tax Writing Committee. Congressman, we have heard all of this before. Do you think it's possible that over the Easter recess that we've seen so far, that the Freedom Caucus has been corralled and is ready to go and say yes to Obamacare reform?
Well, good morning, Stuart. And I think the answer is that we've got to move this thing forward. I think the Freedom Caucus realizes that. They realize that we just can't stall and keep looking for the perfect. And I do think in the end we're going to be able to move this forward. I'm hearing that from a lot of members that I'm talking with. And I'm hoping that when we get back, we can get something passed.
Now, you get back 1 week from today, April 24th. Next Monday, you come back. And on April 28th, you've got the budget battle. That's the deadline for the budget battle. So you're probably not going to see any movement on health care until at least May. Would you agree with that?
Well, I'm hoping we can do more than one thing at one time. I mean, again, we're all professionals, and I think that's got to be the answer. But you're right. We do have the budget issue next week. We have to get past that. I'm hoping we can also get past this health care dilemma and move it forward. Look, we were very close.
We all hope. I mean, Congressman, I'm sorry to interrupt you like this, but how many times have we all heard, we're hoping to do this, we must do that, and it's not happening? Can you tell us, will you tell us that you firmly believe that we will have Obamacare reform on the table when you guys get back from your recess?
Well, believe me, I'm a business guy who does. First off, I probably wouldn't have left until we got it done. But as we continue to move forward, I think we have to get this done. And again, as you heard the president say, it's a starting point for tax reform, which is another issue we have to get done. So I'm hoping that we get back, we get our feet on the ground running, and we can do more than just one thing. The budget will be an issue. The Affordable Care Act, the repeal and replace bill will be, and also tax reform. We have to move all these things forward, and I'm sure we can get this done.
Okay. One thing that I'm hearing is that there's so much to be done. All we'll end up with for tax reform is not tax reform at all. It'll be simply a cut in the corporate tax rate, because that's the easiest thing to do. Have you heard that?
Well, look, I've heard that as well, too, and I would agree. There's not a member of Congress that doesn't believe we have to cut taxes, especially when our corporate rate is the highest in the world. So we have to bring our tax rates down. We have to move forward, and if nothing else, we have to be able to do that. In the business world, you would do that, and then you would look at your expense side of the ledger, and I think that's what the president's talking about. We have to be able to move forward so we can get businesses growing as well.
Okay, Congressman, thanks very much for joining us, sir. We appreciate it, and we'll see you again soon.